Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer from Douglas County with our latest update. I'm wearing my balaclava here. It nicely matches my shirt, but I'm going to take it down for this so that people can read my lips. Again, Dr. Bob Dannenhoffer, Public Health Officer from Douglas County, for our latest update, which is on May 18th. So today we'll be taking your questions. I've got a bunch of things here following up on stuff from the last time that we'll do until we get questions, but let's go over what's happening in the world here. Over 4 million cases, over 300,000 deaths. This outbreak is still very, very potent in the world. And we're starting to see big outbreaks in Russia and Brazil. Those big outbreaks in Russia and Brazil are concerning because neither of them have really first world medical standards. And we're concerned about that they would spread in those areas and then spread to areas outside of those countries that have even less well-developed healthcare systems. The other thing that worries us about the outbreak in Brazil is that Brazil is very hot and warm this time of year, and the fact that this is still spreading at a time when it's hot and humid would suggest there's not going to be much heat effect or summer effect on this virus, and so we may continue to have outbreaks through the summer. In the U.S., we have stabilized the number of cases. They are, I think, slightly starting to go down here. Certainly in the New York, New Jersey, Connecticut area, we're seeing a decrease. Still pretty strong though in Texas, some places in the Midwest, and still California's had a nagging number of high cases. In Oregon, we're doing pretty well. We've stayed the fifth lowest attack rate in the country. We only had 12 cases yesterday, which was our lowest in about 2 months, and we had 64 today. So we're still relatively low in both the number of cases and in the death rate. And in Douglas County, it gets even better. We're still in the 20s. We had a case on Saturday. This was somebody who was only mildly ill, was able to be rapidly tested and had a positive test. We think that we have that case well under control. And so very few active cases. 23 of our cases have recovered, so we only have 2 active cases, although some of the people who have officially recovered are still recuperating from their symptoms. So Douglas County, we're doing well. We opened up last Friday, and over the weekend, I didn't actually notice that much of a difference. I didn't get my hair cut, so I didn't notice that difference. There was one restaurant that I go to frequently that did have some seating, but I was pretty much the only one seated at the restaurant, pretty much where people were still getting takeout. And most of the other places we went this weekend looked about the same. So if you have questions or comments, put them in here, and we'll go ahead and talk about that. So the first question is about a vaccine. And with vaccines, there's the good news and the bad news. So I'll start with the good news. The good news is the Moderna vaccine, which is a RNA vaccine, went through phase 1 trials and passed phase 1 trials. Now, phase 1 trials in this case were 8 people, so a really small group. And these were volunteers who got the vaccine, and none of them had ill effects from the vaccine. But at 8, you could still have a 10% bad side effects and you wouldn't see it. But it got past that, and they developed antibodies, and that's a good thing. Now, whether you're going to see more side effects as you get to a bigger group or whether these antibodies are actually going to prevent disease, we don't know. But this was pretty fast time for a phase 1 trial to be completed. And once this gets reviewed, they can then move into a phase 2 trial, and then a phase 3 trial, and then a vaccine. So the good news is the Moderna vaccine is making good progress. The question here is, will it be a live vaccine? We don't know. Yeah, I don't think it's going to be a live vaccine. To make a live vaccine, what you need to do is you need to take a virus, and then you have to sequentially weaken it. And so it takes hundreds or thousands of passes of this virus to weaken it. It's a very slow vaccine development process. So although we could get a live vaccine, it's likely that one of the other vaccine manufacturing techniques is more likely to come. If we have to wait for a pass of this virus to get it weakened, like we did for MMR, like we did for varicella, like we did and for mumps, that's going to take many, many years, because the steps of weakening it can't be sped up. You have to wait for the virus to grow and weaken it, and then weaken it, and those are limited by the growth rate of the virus. Unlike the RNA vaccines or the protein vaccines, that once you get these going, they can really get going quickly. So we could have a live vaccine, but I think that's less likely. Now, the bad news on vaccines is we've talked a few times about ships and how ships provide a perfect way to study the virus. So the first ship that we had was the Diamond Princess. It was a cruise ship, and that told us that this disease spread very quickly, and it gave us an idea about the lethality and the asymptomatic transmission. So we learned a lot there. In the last month, we've had the Teddy Roosevelt, which is an aircraft carrier, lots of young, healthy, mostly men and women aboard, and they had a big outbreak, 1,000 cases there. The good news is they only had one death among that 1,000, a 41-year-old petty officer. So it shows that in a young, healthy population, this is not a particularly lethal virus, although clearly among that 41-year-old, it really was. But there were 13 of the 1,000 or so sailors that were initially infected that got the virus, got over it, were totally asymptomatic for 2 weeks, had one negative test, waited a day, had another negative test, and remained asymptomatic. So by any measure, these are asymptomatic recoveries. They then came up with symptoms and tested positive for the virus. So unless there's some kind of fluke here, this would suggest that having the virus and getting over it doesn't prevent you from getting it again. If indeed that's true, that's really problematic, because that means the vaccine, which is sort of like getting the disease, won't work. And so we're going to really, 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 really carefully follow that. So Joe says, President Trump has been taking hydroxychloroquine as a preventative. Is this advisable? Does he know something we don't? Well, the president, not surprisingly, has the world's best information. So I hope he knows something I don't. If I know as much about COVID as he does, I'm very worried. But the story is there's some sort of hidden information about hydroxychloroquine. There's nothing that I have seen that would suggest that. Study after study, the VA study, there are 2 studies that came out last week, 2 studies that came out this week, all showed the same thing, that hydroxychloroquine didn't help people who had it. Now, as a preventative, nobody's used a preventative because the FDA hasn't released it as a preventative, and so there's no studies on that. So if he's taking it as a preventative, presumably he's got some in that I don't, but I don't think that there's anything to suggest that it would work. Now, we do have a lot of people who take hydroxychloroquine for other things, especially rheumatologic diseases. It did not seem to prevent those people from getting COVID. So he may know something I don't, but I don't know what that is. Should he be taking it? No. The story is, those of us who are in a privileged position, and I really consider myself to be in a privileged position, I could potentially get access to things that other people could. I could potentially get things for me and my family that other people could, but I so steadfastly avoid that. And the reason I avoid that is that once special privilege allows you to get things that are not available to others, the system breaks down. So when things come out, I get them the same as everybody else. When medicines come out, I don't look for anything special for me or my family. I really try and follow the rules. And as you can see with the balaclava, I use that because I try to follow the rules. And I'm not perfect, but I try pretty hard to follow the rules. So I don't really understand this hydroxychloroquine stuff. So what's your opinion about employers requiring masks even if it affects prior medical conditions? And what's your opinion on employees having to wear masks for the entire 8-hour shift? So again, the reason we wear masks, sign of respect, so I don't give it to people if I'm in that pre-symptomatic phase. And in that pre-symptomatic phase, you're pretty infectious. So 17 hours before you have symptoms is apparently when you're the most infectious. So if I'm 17 hours from now, come up with this virus tomorrow morning, I want to be sure that the people I was in contact with today, I decrease the chance of getting it. So again, it's not for me, it's for others, and it's as a sign of respect. So what's my opinion about employees requiring a mask if it affects prior medical conditions? Well, if it does, that should be an exception. And again, you don't have to be perfect. Everybody doesn't have to be wearing a mask. But I would suggest that probably 95 or 98% of the people can wear masks without affecting prior medical conditions. And so if 95 or 98% reduction in spread was there, that would be pretty darn good. I don't think we have to be 100% on all of these things. And I'm certainly not looking to make people sick by wearing a mask. The other thing, though, is if you're sick enough that wearing a mask is a problem, you probably shouldn't be out. You're probably in one of those high-risk groups that should still be staying at home. And then what's my opinion on employees having to wear a mask for an entire 8-hour shift? It's distinctly uncomfortable. And so I think employers need to recognize that it's distinctly uncomfortable and allow their employees to go outside for walks and breaks and take their mask down. At our place of work, I have a private office, so in my private office, I can take it down. But yeah, this is pretty uncomfortable. And so I wouldn't ask anybody to do anything that I wouldn't do. So I do wear a mask during the day, and I hate it. But I do it because I don't want to make my coworkers sick. I do it because I don't want to make the people in the grocery store sick. I do it because I don't want to do those people I love to make them sick. So Patty says, is it legal for stores to require you to wear a mask? There's going to be a lot of discussion today about what's legal and illegal and governor's orders and law and whatever. So next time we might have a lawyer on who can answer the legal questions. I am not a lawyer. I don't even want to play a lawyer on TV. So I'm not going to answer any legal questions today, and I would refer those to a lawyer. So is it legal? So I don't know whether it's legal or not. It is recommended that you wear masks in stores. Again, this tackling people who are not wearing masks and whatever kind of defeats the whole purpose. I think people should wear masks in stores. I was in the stores this week, and I thought it was maybe a quarter to a third of the people walking around, and almost all of the staff. So that was great. So Amy says, what does remdesivir actually do? So remdesivir is an antiviral drug, and it inhibits the RNA viruses. So RNA is the stuff that is basically, as I've discussed in the past, sort of the scratch pad. So that if you think of the DNA as being the code, and then the scratch pad says, okay, we want to make this protein, what should it look like? And I copy what this should be. That's what the RNA does. And you can inhibit RNA replication, and that's what remdesivir tries to do. It's not very effective in this, and not very effective in Ebola, for which it was developed. But it suggests that the RNA replication can be interrupted in this, and so it's like the beginning maybe to developing a very effective antiviral drug. Because if you had a very effective antiviral drug, it would really change this disease. It would be like, okay, I got it. Give me the antiviral drug and I'll get better. And so there are lots of viruses out there for which we have very effective antiviral drugs. And so if you get a really effective antiviral drug, that would totally change the complexion, because it would change this from a public health catastrophe to a medical problem that we could deal with. So for example, on HIV, almost everybody now with HIV can take a medication that can reduce their viral load to zero. I say almost everybody, it's not everybody, but almost everybody can reduce their viral load to zero. So it's really changed HIV from being a huge public health catastrophe to a manageable medical problem. So I remember early on in the HIV thing when Magic Johnson got diagnosed, and it was like, 30 years later, he's still pretty healthy. So Ryan says, what do I make of the Sorrento therapeutic news over the weekend? I'll have to see what that news is. I've read it, but I don't remember. So is Mercy Medical Center open to anyone? Business as usual, Linda asks. Well, it's not exactly business as usual. They're not back to 100% of elective surgeries, but they're back to certainly some elective surgeries. Their ED is open. However, some of the things that we learned during this COVID-19 thing, we might learn again. One would be about going to the emergency room for little stuff. A lot of people didn't go to the emergency room for little stuff during this time, and we should rethink going to the ED for little stuff. If it's a little thing, you might call your doctor, go to the urgent care rather than going that. But for the most part, Mercy's pretty much open. They're doing as much imaging as they can do. They're doing most of the elective surgeries. They're certainly doing all the emergencies. Okay, so please discuss what you believe, how we should react to the news in Baker County ruling today. And again, this is what I'm going to give to the lawyer. I don't know. So was our new case the 24th was just not counted right in the recovery case altogether? So this is about as confusing as possible. So on Friday, there was a case that counted in Douglas County that was a mistake by somebody in another county who misplaced a person's name. John Smith became Smith John, and they got counted as a new case when it was really an old case that just had another test. However, on Saturday, there was a case in Douglas County came in the early morning after the OHA stopped counting. So the OHA didn't count it on Saturday, but they got it on Saturday night and counted it on Sunday. We had the right number of cases, 24 on Friday, 25 on Saturday, 25 on Sunday, 25 today. So that's how that happened. And it's only because people count at different times that you get this difficulty, and because people do transpose names. So Lori asks, when school restarts, will they be taking students' temperatures as they enter the school? So we had this long discussion last week among 20 COVID nerds about taking temperatures and whether taking temperatures is useful or not useful. And there was a long story in the Washington Post about all the differences among states and different places about taking temperatures. And I think it comes down to this, is that taking a temperature is not a particularly good way to look for COVID. Most people are not having temperatures in the first or much temperature in the first or second day of the illness. And because of that, you could go in, they take your temperature and they let you go, say you're good to go, and you're really not. And we think actually this led to problems. So from people returning from China, that's how they screened them mostly, is with temperature, and all these people had normal temperatures when they were let in the country. Many of them were brewing the disease. So temperatures can be misleading in that way. The other issue with temperatures, you have to get relatively close, unless you've got one of these FLIR things. You have to be relatively close, and that puts another exposure. On the other hand, it might help if you were able to detect somebody who had a fever and didn't know about it. I have actually tried to find a single case where a case of COVID was diagnosed because an asymptomatic person had a temperature. They said, buddy, you've got a temperature. You usually get a test. They get a test and they find they're positive. I'm still looking for the first case in that. I've yet to find it. It might exist. So the question is, are temperatures useful or not? I think it's still totally up in the air. So can masseuses return to their practices, Judy asks, and I think the answer is yes. I haven't specifically checked the guidelines for that, but I think they fall into the personal service workers. So with restaurants reopening, will buffets and larger salad bars be allowed to open? Dan asks. I think in phase 1, not. Maybe in phase 2. Salad bars, though, are really a concern. I mean, I've been to some salad bars. There's always congregation among the at the salad bars. It would be pretty hard to do those without congregation. So Melody asks, is just wearing a mask effective enough? No, 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 and no again. So the most effective things are staying home when you're sick and social distancing. So if you look at the orders of magnitude of protection, the highest protections are N95 masks, but you're not going to do that. Staying at home and physical distancing. Next is wearing masks and hand washing and whatever. And then lower on the list is asymptomatic testing. Unfortunately, I think we've gotten confused because, sad to say, the White House has used asymptomatic testing as its only strategy and hasn't done, until recently, social distancing and masks. So again, most effective, stay home when you're sick, social distancing. Next tier, masks and hand washing. Next tier after that, asymptomatic testing. So once you've done the social distancing and the stay home when you're sick, once you've done the masks and the hand washing, then doing asymptomatic testing actually makes sense. So Veronica has a question about the Baker City ruling, and again, we're going to ask our legal experts on that. So do all people with COVID have a high temperature? If not, why are companies taking temperatures, Diane asked. So the answer is most people with COVID don't have temperatures at all, at least in the beginning stages. Now, later on, most people do complain of chills and do get fever as they get more symptomatic. But it's really the early stages that we want, and most people do not have a fever at presentation. And they usually don't have high temperatures, unlike this pediatric thing, which we'll talk about later, where kids really do have high temperatures. The temperature in this is not very high. So many of the people have say, I felt warm. You take their temperature, it's normal. And then the other question is, what's the temperature? Is it 100.4? Is it 100? Is it 99.5? So I refer you to that Washington Post article, which says we can't agree if taking temperature is important, and then we can't agree on what the temperature should be. And the reason is that temperature is not a particularly good thing for this disease. And you can take a temperature, but you should never confuse a normal temperature with absence of disease. So Alan says, can you tell us about contact tracing? How many people are working on this? Any stats to put up? So contact tracing means that you find a case, you interview the case quickly, and then you find all the contacts. So our new case over the weekend came in around 9:30. By noon, we'd contacted the case and all the contacts, and we found out all the contacts. That's what contact tracing is. With this was one simple case. It was relatively easy to do. If we'd had 20 cases in a day, it would be at least 20 times that, and more complicated if the person had a lot of contacts. The other thing that contact tracing is dealing with the people who are in quarantine and in isolation so that you can provide for their needs. So if they say, Bob, you need to go, and I live by myself, say, Bob, you need to go home and quarantine for 14 days. Well, it'd be pretty hard because I probably have 14 days of food, but most people don't. I might need to have other things done at my house. And so the contact tracers are there to help with other things that I need. For example, I may need to get some medicines from the store. The contact tracers can help you do that. The contact tracers can bring food. We've had a couple of people that have been quarantined in a motel. And when they've been quarantined in a motel 3 times a day, we bring in them breakfast, lunch, and dinner, and they're bringing them everything else they need. So I was doing that yesterday. So I brought breakfast and dinner to a fellow that is being quarantined at a local hotel. And that's what contact tracers do in addition. So they track down the cases, they talk with the people each day, they help them with their needs so that they can be successful in their quarantine and isolation. So Melody asked, clarify, the question was the efficacy of the mask covering the mouth and the nose, not just the mouth. Well, we know that when you cough or sneeze, that stuff comes out of both your mouth and your nose. Actually, with sneeze, it comes more out your mouth than your nose. A cough, it comes out a little bit more than your mouth and your nose. But heavy singing and breathing and whatever, it comes out both your mouth and your nose. So you really have to cover both. So I saw a lot of people this weekend doing this. It doesn't protect it very well. So Dana asks, do you think social distancing, mask screening, and staying home even when not sick will help us to get through the flu season easier? Dana asks, and the answer is absolutely. So that if we were able to do that for flu season, we would also be able to decrease the incidence of flu. Now, because flu is much less deadly than COVID, and that's the next thing I'm going to talk about, we generally don't do that. Also for flu, we've got a vaccine. Also for flu, we've got a quick rapid test. Also for flu, we have Tamiflu. So that's the case. So one of the things that's been going on there is 60,000 people die every year of the flu, and COVID's now killed 90. What's the big deal? So let me tell you the big deal. So somebody in JAMA Internal Medicine last week looked at this, and they said, okay, you have to count apples to apples, and you have to compare apples to apples and oranges to oranges. So let's take about how we decide about flu deaths. So we've talked a little bit about this before, but the way they do flu deaths is by looking at the amount of flu that's out there, not just those people who are diagnosed with the flu, who die specifically of the flu. They look at everybody out there at the time that fits into that ICD-9 or 10 diagnosis. So when you compare it the same way, you say, let me take the number of counted flu deaths versus the number of counted COVID deaths. There are 20 times more deaths from COVID over the last 4 weeks than there were from flu at the highest time ever. Again, so 20 times more deaths from COVID than from flu if you counted them the same way. So if you counted COVID deaths the way you count the flu deaths, the COVID deaths would be really high. If you counted flu deaths the way you count the COVID deaths, the flu deaths would be really low. But 20 times more deaths from COVID than from flu. And that's why when people say, oh, it's about the same, why do we worry about it? That's why, because there's 20 times as many deaths. And there's no other way to do it, to take care of it. So Kayla says, how effective is wearing gloves all day to protect yourself when you have to handle many credit cards, money and credit cards? So the way that gloves help you is if you use gloves correctly. So I use gloves a lot when I do pediatrics. So I'm going ahead and lancing a boil. So I wash my hands, I put on a pair of gloves, we lance a boil and get all the stuff out of it. And then when we're done with this, we very carefully take off our gloves and wash my hands again. And that helps my hands from not getting those germs on them and spreading them elsewhere. But I have been trained in doing that. Then when you're touching this stuff and all that stuff, you don't touch your face and your ears and your hands. And so the gloves in that case are incredibly effective. Unfortunately, what I've seen with people with gloves is they wear gloves but do everything that they did before. So they wear the gloves and they touch their face, they touch their hands, they touch everything else. In that case, gloves don't help you at all. In fact, I think gloves may hurt you because you think, well, I'm wearing gloves, I can touch my face and everything else. And so gloves only help if the story is my gloves only touch other things and they never touch me. So if you went to the store and the gloves only touched the cards and the money and whatever, and then when you took them off, you took them off properly and washed your hands, it would be great. But similarly, COVID is not so contagious through the skin that if you just washed your hands when you got done with the money, you would be fine too. But the most important thing is that you don't touch the credit card and everything else and then touch your face. And so there was one guy I saw this weekend in the grocery store. He was touching his face again and again, and he had on these black gloves. And I was like, buddy, I didn't stop him, but like, buddy, you're doing it totally wrong here. So Kelsey says, what's your recommendation for a child to have their adenoids and tonsils removed? Should we wait as it's not critical? I don't know. Tonsils and adenoids can be anywhere from annoying, let's get rid of them, especially if you have something like tonsil stones, which are these little things that pieces of old food that stick in your tonsils and give you bad breath. That's not critical. On the other hand, there's some people who've got an abscess or some people in there have sleep apnea. So I talk about it with your doc and decide if you would want to wait a little bit. You know, there are some advantages in waiting a little bit on these things. If you wait until we get a vaccine, then the risk is much lower. On the other hand, you may not want to wait that long. So on all of these elective surgeries, it really depends on many factors. So I would talk with your doc about whether you would want to do it now or to wait. The biggest issue is going to come with dental, right? So there's a bunch of dental things that we should have on a regular basis, and it's a complicated decision about whether to wait or to do it now. Ryan says, what about wearing masks during strenuous exercise? So wearing masks during strenuous exercise can be a bit of a problem because you're breathing hard and breathing fast. Although I noted on one of these things that people actually buy these masks that restrict your breathing to train your lungs. They don't make that much sense, but they're out there. And if you go to Big Five, you can see these. And what they do is they limit your breathing, so you have to breathe harder and presumably get stronger along the way. Most strenuous exercise you're going to do outside, running, biking, you're going to do outside. And again, I think if you're adequately socially distanced outside, you don't need to be wearing a mask. So when I bike ride, I wear a mask, but not all the time. It's only when there's other people that I'm seeing along the way. And that's another thing that I want to talk about is the relative risk of inside and outside. And what I said was outside seems to be far safer than inside. Now there's data to back it up. So on all of these things, that when I say these things, it's because there's data to suggest this. And then when data actually comes out, I look for that. So they looked at 7,000 outbreaks in China. And there was only one of those 7,000 outbreaks that happened outside. This is where two neighbors were talking closely and loudly, and there was outdoor transmission. The other 7,000 transmission occurred indoors. And so indoor is so much more risky than outdoors. And a Northwest example from Skagit Corral. So 62 people were in a choir practice for 2.5 hours. And they were doing things you do at choir practice. They were standing close and they were singing loudly and presumably making droplets. There was one person that was sick, and 52 of the 64 people got infected, and 3 got hospitalized and 2 died. Yikes. So, I mean, that suggests how incredibly contagious this virus can be, especially when you think about this. People were close, people were indoors, and people were using their voices. That is pretty contagious. So 3 hospitalized and 2 died. That's why we worry about stuff like indoor basketball games. That's why we worry about stuff like church services, because in those areas, people are relatively close, using their voices for a long period of time, and that's a worry. Okay, so the other question we'd had last week was about why don't we do something like Corvallis? And I said, well, that's a research study to show how much disease is in the community. And I saw that of the 672 people they sampled, 0 were positive. So that would go along with my thought that there's not very much asymptomatic disease out there when there's not much symptomatic disease. Now, when there's a lot of symptomatic disease out there, like happens in New York and Connecticut, we think then there's also a lot of asymptomatic disease. But I think the best data now suggests that no more than 40% of the people are always asymptomatic. It's probably more like 25% stay in asymptomatic. So while there's a lot of focus on asymptomatic, really we should be focusing on the symptomatic. Because if you got the symptomatic level down to nearly 0, the asymptomatic level would also be nearly 0. So this idea that you have a lot of asymptomatic disease and very little symptomatic disease just doesn't seem to be the case. So Nancy says, is it safe to receive communion? Well, there's probably a safe way to do it. I was an altar boy for many years. So there's probably a safe way to do it. You know, when AIDS came out, people were really worried about transmitting AIDS. It turned out that that was not much of a worry. I think in this one, it's only a worry because with communion, you tend to be fairly close, although it's a fairly short interaction. And I've heard of some churches doing things where they have, for example, communion wafers in little sealed packets, and they hand them to you in a way which is safe. So I think in the whole deal, it's not particularly dangerous. So Jenny says, more testing. Let me put a little finer point on that. So the story is testing lots of people in an area where there's very little symptomatic disease is unlikely to get you very far. I know that's really unpopular among the people who say all we have to do is just test everybody and we'll get it there. But I will tell you that that is not a particularly good strategy. A far better strategy is to be sure that we test everybody who's symptomatic. And we're not there yet, right? So your chances of being positive when you're symptomatic are maybe 10 times higher than when you're asymptomatic. And the reason I say that, you say, well, you know, 25 or 40% could be asymptomatic, but you're asymptomatic for 50 weeks of the year. You're presumably only symptomatic for a few days of the year. So your risk of getting a positive test when you're symptomatic is so much higher than on the days you're asymptomatic. So what I would strongly suggest is that people who are symptomatic get tested. It's hard to get people who are symptomatic even to want to get tested. So that would be my first call, to do more symptomatic testing. So how many children in Oregon have had this mysterious illness linked to COVID? And what do we need to know about this? Well, we only think 1 so far, but there may be more. But again, that's not surprising because we think that this disease only showed up where there's lots of other disease going on and shows up after the peak of the other disease. So in Italy, they saw the big peak of disease and then saw this pediatric disease following it. In the UK, they saw their big peak of illness, and then they saw this following it. In New York, they saw a big peak of illness, and then they saw it following it. Oregon's never had that big peak, so we might have a few cases. I don't think we're going to have 100 like they had in New York. But this is a bad disease. This is not missable. These kids have high fever. They're really sick. They frequently have rashes, cardiovascular collapse. So these are not kids we're gonna miss. Now, it may be hard to make the diagnosis because it's a relatively new syndrome, but it's not as if people are going to say, oh, I didn't even know I was sick. These kids know that they're sick. So I think we are going to see some cases. Hopefully we're not going to see any more. So Brandy says, is there any health risk with wearing a mask all day? Some people claim they'll get carbon dioxide poisoning. So we know you can if you have a very tight-fitting mask. There are people who will just sort of hypoventilate. We've seen this with scuba masks sometimes, but these kind of masks, these are not tight-fitting enough to cause trouble with CO2 retention. Even N95 masks are not tight enough to cause that. So I don't think this is a risk for most people. So Laura says, do we have enough contact tracers? Well, with the number of cases we have now, we have more than enough. We've had contact tracers on for a month, and they basically are training and doing other kind of things. They don't have many cases to trace. So if you think of a contact tracing case, it takes a couple of hours for the first interview, and then it takes an hour or so of time for everybody they may have contact with. And then on a daily basis, it takes some time each day for everybody who's in quarantine and isolation. So let's think of a situation where somebody was intemperate and had 20 contacts. So it would take an hour or two to do that first interview. It would take 20 hours to do the contact tracing of the contacts. Then all of those people would have to be in quarantine and isolation, and it would take a day. It would take almost a whole day each day to follow just my one case if I was not careful about what I did. Now, in my case, I think I've only had one contact a day since March, and so my wife would have to stay in quarantine with me, but wouldn't be a big deal. So it can take anywhere from, per case, it can take anywhere from a few hours to 100 hours per case. Right now we have plenty of contact tracers because I said we've only had one new case in the last 2 weeks. So I thought we didn't count adult flu deaths in Oregon. So this is a deal. So in kids, we count the number of flu deaths by kids who have a positive flu test who die in hospital. So we do count kid flu deaths the same way we count COVID deaths. And so when you look at the flu deaths in the CDC weekly thing, there's this green and yellow graphic that shows the amount of pediatric deaths. And so these are kids who have a positive diagnosis of the flu, and then die related to the flu. And so we count it. And those numbers are fairly small. Those numbers are a few hundred a year. Now, it's one of your kids, that's a big number, but overall it's a relatively small number. The way we count flu deaths in adults in Oregon is the statistical method that the CDC uses. It's a very complicated story. So for the people who are interested, if you look at JAMA Internal Medicine, flu versus COVID, it goes through the very arcane way that they count it. And again, its conclusion was that using the same methodology, there's 20 times as many COVID deaths as there are flu deaths. So Barbara says, where can I get the mask with the clear window for lip reading? We have a couple of them here, and we'll put the link on the deal. So Nancy says, are children having brain damage from COVID-19? We know adults are having strokes from COVID-19. We don't know yet much about kids. Now this inflammatory disease that kids get, this Kawasaki's like inflammatory disease, we think also inflames the blood vessels to the brain, although most kids do, the ones who don't die, have a fairly full recovery. But we don't know. You know, this is a virus we're learning so much new about. I mean, who would have guessed a virus that causes gangrene toes, that causes anosmia, that causes clotting problems, that causes lung problems? All of these things we don't know. So I think as we learn more, we'll do it. But again, there are not that many kids who have it. So many are advocating for mass testing. Shouldn't we be more concerned about the consequences of false negatives than false positives? So for the PCR testing, the molecular testing, the swab in your nose, there are very few false positives. So I wouldn't worry too much about that. But I do worry about false negatives, because false negatives then make you think I'm good to go and I can see the president and I can be in close proximity to other people. That is so wrong. These new Abbott tests, like the one they use at the White House, probably only catch 50% of the people who are positive. So if I was positive, half the time I'd say, you're good to go. Why don't you go in for a meeting with 30 of your closest friends? That would be terrible. Because what the testing should do would be, yes, you might test people and find people and get them into quarantine. But then when they contact that person, they say, well, I didn't have any contacts because I've used excellent social distancing. And so unfortunately, I think what people are doing is that they're confusing that testing could allow you to get rid of the highest order things, remember, social distancing and staying home when you're sick. And so I worry that people are going to misuse the results of testing. So we had a question today about testing for people entering a high-risk facility. And the story was, well, if they were negative, then then we didn't have to worry about them. No. A negative testing means that you're negative today. You could be positive tomorrow. You could be positive today and it missed it. So I think we really do need to worry about false negatives. Now, how did other countries deal with the fact that they had false negatives? Because they had false negatives too. So the false negatives aren't the fault of the test. The false negatives are just the fact that there's not very much RNA in people's noses or in their throats. So how did they deal with it? Well, they said if you were positive, if you were sick and got tested, you had to stay home until you were well. We recommend that. If you were asymptomatic and you got tested because you got tested for whatever reason, you still need to maintain social distancing, and that's what I would recommend. So Stacy says, what do I think about teeth cleaning? Well, I think teeth cleaning is a good thing. And should I ask about what they're doing and what I should do? So the dentists are well aware of the infection control procedures. Teeth cleaning, though, is a bit of a risk, right? Because when they do the teeth cleaning, they're picking away at your teeth and they're using those little ultrasonic nebulizers and they're squirting water in there and air and whatever. All of those things which could generate an aerosol, which is a really fine particle thing. So they need to be wearing high-level protection. And I think the dentists in town are kind of scratching their heads about what to do about drilling, teeth cleaning, and all those kind of things, because it does put their staff at a little bit of a risk. So how serious should pediatricians and parents be taking high fevers given the Kawasaki-like infections? Well, it's more than just the fever with this Kawasaki-like thing. They have fever and some very characteristic other findings with the red lips and the red tongue and the red eyes. So these are not things that you're going to easily miss. Now, you may not initially make the diagnosis, but you're not going to say, well, that kid looks great. I don't know what you're talking about. These kids all look pretty sick. So one of the other questions we had is about relative risks. So I looked this up. So I'm a fairly careful person. I drive kind of according to the speed limit, and I don't do many risky things. So my risk of dying in an accident in this next year is 0.1%. That means 0.1%, 1 in 1,000. But if I got COVID, my risk of dying of COVID is 4%. So in this next year, if I got COVID, my risk of dying of COVID is 40 times what my risk of my sort of natural activities would be. You say, well, you can't be assured of getting COVID. Well, if we did nothing, we think 80% of the people would get COVID. So it would be 32 times more likely than dying in an accident. That's a lot, because I worry about dying in an accident. I wear my seatbelt and I drive safe and whatever. Let's say I say I'm going to take the year of living dangerously. I say, honey, I'm going to take up skydiving, scuba diving. I'm going to trade in my car for a motorcycle, and I'm going to pilot a private plane. 4 of the riskiest things I could do. That would increase my risk of dying in an accident to 0.5%, but still my risk of dying of COVID is between 3 and 4%. So even living incredibly dangerously in that year, I'm still 6 or 10 times more likely to die of COVID than of all those things. I mean, that sort of puts it in perspective that this is pretty risky. Now, if I was 20 years old, that wouldn't be the case, because the risk of dying of COVID is probably about 0.2%, and those other things are risky. So I'm certainly not recommending that people live dangerously, but for people in my age group and older, certainly the risk of COVID is enormous. Many times the risk of dying in an accident, even if I did that year of living dangerously. So what's the plan if we get another outbreak after opening up? We're almost certain that we will. And what's the threshold for cases before restrictions are put back into effect? So I think we're going to look at serious cases. I don't think you can look at just the number of cases, because as we do more and more testing, we're going to find more and more cases. That doesn't really worry us so much as the number of hospitalizations. The number of hospitalizations is not really dependent upon the amount of testing you do. So we're going to look at hospitalizations, and if the number of hospitalizations went up significantly, we might have the restrictions put back into place. Now, the restrictions wouldn't count until you had an increase in 5 hospitalizations, which would mean, since about 1 person in 4 gets hospitalized, it would be 20 new cases over a short period of time. So I don't think that's going to happen. But, we've used a lot of firefighting analogies. We were saying that this was a big, massive blaze that we've been trying to put out, and right now there's still some hot spots. And I think there are some hot spots still, maybe places in the county where there's disease that we don't know about. And that these new little outbreaks are going to be new little fires, either in that area or just new fires elsewhere. And in firefighting, we do have new fires that are going to come up. But if we can get around those fires, limit those fires, get them out, we'll be fine. The thing that we worry about is that you have so many fires popping up at once that we run out of fire trucks to put them out, or that the fires start to get so big that they start to coalesce. That's when we know we're in trouble. But I think with enough contact tracers, with all the testing that we're doing and all the things, I think we're going to be able to keep these down to small outbreaks. But it depends upon everything that we do. Again, if you can get 50 cases from one choir practice, we can't be doing those big choir practices. So how long should someone quarantine after being exposed? So the recommendation is that you quarantine for 14 days. And the reason we say 14 days is that almost every case of this will show up within 14 days of exposure. Most cases actually show up 5 to 7 days after exposure, but almost every case will show up within 14 days of exposure, and that's why we recommend it. So Kat says, I was told that Mercy is using the Abbott test now. Is that true? And that is indeed true. And in fact, our last case was diagnosed using the Abbott test. So the Abbott test, again, is a fast test. You get positive results in just a few minutes, negative results within 15 minutes. And the good news on the Abbott test is it's fast. The bad news on the Abbott test is it's not very sensitive. So a study came out over the weekend suggesting that it's only about 50-50 insensitive. That is, people have the disease. About half the time they'll show up as positive on the test, half the time they'll show up as negative. So the test is most effective if you have to have a quick result. So say I get appendicitis tonight and got to do the thing and so got to do the surgery tonight to fix my appendix, but you want to know quickly whether or not I have the disease. Perfect reason for the test. Another good time for the test is if you are in the emergency room, not particularly sick, but sort of be nice to know the diagnosis while the person is there rather than for waiting to go home. So the recommendation then is to do both the Abbott test and one of the slower tests. And if the Abbott test is negative, then to send the slower test. So they can say, well, the preliminary Abbott test is negative, but the other test is going to take a day or two to come back, and then we'll know the more accurate results. So Abbott tests are pretty good for that. I wish they were more accurate, but 50% sensitivity means that half the time that somebody has a disease will come up negative. That's not so great. Did you figure out the Sorrento? So Ryan, if you could tell us which of the Sorrento you were talking about, we would know. So other things we wanted to talk about today was the outdoor transmission, which we talked a little bit about. Again, outdoor transmission seems to be much safer. So the idea that you need to wear a mask outside where you're sunbathing or hiking or whatever, pretty unlikely. So the good news is we can do that. So I'm encouraging people to go out. We're going to have beautiful weather, I think, over the next few days. Go out, get some sunshine. We do know that people are getting a little bit cooped up, so rather than going out and having time with 50 of your closest friends, really close where you could spread the disease, go out with yourself into the wild and enjoy hiking, enjoy biking, enjoy some walking. I think we're doing a good job getting through this, and I think we've done such a good job getting through this because people have basically followed the rules along the way. Who knows what the rules are today after that ruling from Baker City, but I would still encourage people to do that. So Kelsey says, using my example of appendicitis, what happens if your COVID test is positive? Would they use more PPE, or what would they do? Well, a couple of things that they might do differently. So one of the ways to treat appendicitis was with antibiotics at home. It's not quite as effective as taking it out, but if you had a way, somebody who had COVID and might come up with a lung disease, and the reason you want to know about that is because there have been a couple of examples where people developed COVID a day or so after they had surgery. They didn't do very well. And so this was a time before you could do those rapid tests. So they didn't do very well. So you might say, well, Bob, in your case, it may be better for you to use the oral antibiotics rather than to have your appendix out. The other thing that they may do is they may choose to do it under a spinal anesthetic rather than a general anesthetic, which they would normally use, because again, then you wouldn't have to be intubated. And they would certainly take lots of PPE precautions. Although I will tell you, the hospital is so safe now that they're using a lot of precautions. Yeah, people saying that they have 100% cured of the disease. I'll look that up tonight. I would guess not. Because if they did, I would think that you wouldn't have to explain to me what this meant if they had it. But I'll look that up tonight. So are face shields more effective than masks? So face shields are very effective at protecting your eyes. And your eyes are important. People miss the eyes. You know, your eyes are these moist mucous membranes. And if somebody coughs into your eye, usually you blink in time, but not always. And so that if moist things get into your eyes, these viruses can grow then in the area your nose is your eyes are connected to your nose, and that gets into your nose and then gets into your posterior nasopharynx, which is where we're sampling from. So yeah, you need to protect your eyes, and face shields are very good at protecting your eyes. They are not particularly good at protecting your mouth. So could you wear a face shield rather than a mask if you're, for example, one of these people who for medical reasons couldn't do that? And I think that's right. Actually, one of the people that I know works at a grocery store can't wear a mask for a respiratory reason, and they wear a face shield instead. And that may not be perfect protection, but nor is a mask. But that would be a reasonable protection, and they're not totally uncomfortable, where I wear face shields for hours at a time when I'm in the shop. So Nancy says, is insurance covering the antibody test if ordered by a physician? We do not know. We do not think so, but you have to check with each of the labs that do it. The one that we do know is the nasal PCR test ordered by a physician, done at Quest Lab in our drive-through. They've promised us that the patient will not get a bill for that. And so far they've been good on that, but I do not know about the other things. Okay, well, it looks like we're coming to an end here. Again, I'd encourage people to take good care of yourself. We're doing a great job. We will get through this. I think we're going to have a few bumpy weeks or months until we get there. I'd encourage people to, regardless of what the orders say, is to do the right things. And again, that's socially distance and stay home if you're sick, the highest things. The next things to wear a mask and to do lots of hand washing. The next things is to consider asymptomatic testing and other strategies that you might use. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Thank you for joining us. We're going to do this again on Friday night. Thanks so much.